All right, everybody. Sorry to say this is going to be kind of a working lunch, so I know you guys are having a good time networking. Is everybody enjoying the conference so far? You guys having a good time? Yeah. All right. I don't know if I mentioned it yesterday, but this is actually the most people we've ever had at a Housing Homelessness conference here, so I'm really excited. All right. A couple things before we get started here. One, scheduling change. So on your schedule it says that there's going to be an update on the federal plan in this room next. That's actually going to be over here, and it's going to be more of a dialogue with our panel. So that'll be in the Fairbanks room, and the dynamic prioritization presentation will be in the Anchorage room. So there's that. I did want to give a shout out, I haven't yet, to all the amazing AmeriCorps Vista volunteers that have made this possible. They came in an army. They heard there was free food in it for them, so, you know. And then also tonight at 5:30, there's a tour of Carlick Manor, really cool, permanent supportive housing here. They have arranged for a van. There's going to be limited seating, so if you have a car, try to help out folks. But if you want to try to grab a ride, just go to the lobby downstairs at 5 p.m. sharp to catch that. It should be a really cool tour. I would like to also make an announcement about our board elections. We've got the results all tallied here. There were 8 available spots this year, and here are the results. Excuse me. So re-elected to the board this year is Scott Schomburg from the City and Borough of Juneau and Beth Wilson with the Division of Behavioral Health. So congratulations. Looking forward to working with you guys for 3 more years. And then we have 6 new board members, and I'm really excited about this. So starting off with Jana George from the Interior Regional Housing Authority. Are you in the room, Jana? Are you? No? I know she was running in between meetings. So Jasmine Kahn with the Anchorage Coalition and Homelessness. It's going to be some great COC to COC work now. Gabe Lehman from Cook Inlet Housing Authority. Really excited. Dr. Monsager from the Rasmussen Foundation, congratulations. Leslie Rohr from Love Inc. on the Kenai Peninsula. And Charlene Tautfest from the Alaska Mental Health Board, so congratulations, Charlene. So the sad news is that means that we have outgoing board members that have been fantastic to work with as well. We kind of had more openings this year because we saw kind of a series of retirements and folks kind of moving on. So I would like to recognize the hard work of John Spurbeck, John Weaver, Catherine DeLacy, Maria Lovashuk, Jordan Nigro, and Sam Okakoke. They've been fantastic to work with, and I'm sure they aren't going to be strangers. So one more hand of applause for our outgoing. Yeah. All right, and with that, I'm really excited about our lunch plenary today that Colleen Bickford from our Anchorage HUD field office will introduce. So here's Colleen.
Great. Thank you very much. Well, good afternoon, everyone. It's good to see so many familiar faces and lots of new faces. We are really pleased to bring some of our federal partners into this panel and hope that our updates helps inform your work. And before we get started though, I do want to say this is another great conference. We really appreciate being able to participate. I really compliment all of you on the work that you're doing. The coalition updates were just remarkable. Clearly a lot of really great collaboration and coordination, and we hope that as your federal partners, we can help you to continue to do that good work and help address the gaps that still exist in our system. So we have a panel of friendly feds here to talk to all of you today. And before I introduce the folks that are going to be talking with all of you and giving the updates, I also want to recognize a couple of other people in the room. One is Jeff McMorris. Jeff is not a stranger to Alaska. He is HUD's Region 10 administrator, so he's our top boss for the 4 states which make up our Region 10. Jeff's been up here. He was at the Fairbanks Homeless Symposium last December, and accompanied us on a trip to Savunga that was talked about earlier, Savunga and Nome. And then we did another regional tour. Some HUD dignitaries from headquarters took them to Dillingham, Galena, and also visited in Fairbanks. So Jeff, thanks for coming back. I also want to mention in our HUD Anchorage office, we have a new leader in our office. I want to introduce, many of you probably already know Greg Stuckey, but we brought Greg on a couple months ago as the head of our Alaska Office of Native American Programs. So thanks for coming, Greg. So now, without any further ado, I want to just briefly introduce our four panelists, and starting with no stranger, Katie Miller is going to kick it off. Katie is with the U.S. Interagency Council on Homelessness. Katie's also been on several of the trips this year, including the Savunga trip. She may talk about that again, but really glad to have Katie's interest, and we're benefiting tremendously from her leadership and her help. So following Katie, Karma Reed, who is HUD's Alaska, she's the director of our Office of Community Planning and Development. She's going to be HUD's representative talking about all kinds of HUD updates. Following Karma, we'll have Kathy Gerard, and Kathy is visiting us from the Northwest as well, out of Seattle area. She's the network homeless coordinator for the Veterans Administration, the Northwest Health Network. And finally, Mercedes Garcia has come all the way from Washington, D.C. We were romancing her, trying to get her to come up. But she's no stranger to Alaska. So Mercedes is with the U.S. Department of the Interior Office of Indian Affairs, Bureau of Indian Affairs, as most of us refer to USBIA. So with that, Katie, why don't you kick us off? Here we go.
Great, thanks, Colleen. So again, I'm Katie Miller, and I work for the U.S. Interagency Council on Homelessness. If you're not familiar with USICH, our job is to coordinate the federal response to homelessness, which is no small task. So we coordinate 19 federal agencies. These are the agencies that are part of USICH. We're a very small and scrappy team. Fully staffed, we're about 16 staff at USICH. We're a separate federal agency. There are 5 of us that don't live in Washington, D.C., and I'm one of them. I live in Seattle, and I coordinate 13 states, really working with states from the Dakotas to Hawaii up here in Alaska and down towards Nevada, working to bridge the work that's happening at the local level with what's happening at the policy level in Washington, D.C. So as Colleen mentioned, and as Brian mentioned, the next session, we'd like to have a much more informal conversation. So I'm going to take some time to go through our brand new federal strategic plan in this session. And then at the next session, we really want to have an informal conversation with you to find out what's working, what's not working, what are the major challenges that you're facing in your communities, what do you want folks in Washington, D.C. to know, and how we can help you actually implement this work at the local level. So, so that conversation will be happening next. So we are super excited at USICH that we just released a brand new federal strategic plan. So if you were familiar with our previous plan, Opening Doors, this is a new version. So this is now called Home Together, and we released this in July. We spent a lot of time obsessing about a title, which we all do when we create new plans, and but we felt really good about this one because the term home, as my boss will say, home, comma, together, home being the place, the foundation where we stabilize families, so in households. It is the platform for where people can rebuild their lives, where people can pursue opportunity, and where folks can get healthy. So housing is the key to ending homelessness. So home, and then together, because we have to do this together. It is going to take all of us working in partnership at the local, the state, and the federal level to make this work and to actually end homelessness. We went through a significant amount of stakeholder feedback, really to get input. We wanted to know sort of what we've done to date and where we missed the mark, and really wanted to hear from communities. So we reached out to many different communities. We got a lot of feedback from national partners and folks who are experiencing homelessness to inform this new plan. And I just want to say that we continue to really appreciate hearing from you all and understanding what is working and what's not working. We have some shared national goals, so achieving these goals requires strategic focus, effort, and investments from both the public and the private sector and all levels of government. We will continue to work on ending homelessness among veterans, chronic homelessness, people with disabilities, families and children, unaccompanied youth, and other individuals. In the previous plan, you probably saw that we had specific time frames for doing this. So, for instance, we were going to end homelessness by 2020 or end veteran homelessness by a certain date. We have made a lot of progress by having those very aggressive, ambitious goals, but what we heard from communities is that those goals were very tricky politically in a community because different communities had different resources and they were able to move at different speeds, and so that those timelines really were difficult. So we've taken the timelines out, but what we want to do is help communities at the local level set aggressive timelines that make sense for what you have going on, whether it's targeting a specific population or working towards all populations at the same time. And so we are going to be here to work with you towards that. The structure of the plan is grounded in a shared vision. To end homelessness, every community needs to implement a systemic response that ensures that homelessness is prevented whenever possible, or if it can't be prevented, it is a rare, brief, and one-time experience. So this plan is completely set up based on that concept. The criteria and benchmarks, we've now created federal criteria and benchmarks for all populations. These are the roadmaps that all of the federal partners have agreed on for ending homelessness for all populations. They are the quantitative and the qualitative measures to provide the roadmap for assessing how local systems are designed and implemented. And I'll say that also every bit of this is based under the idea of housing first. So housing first and permanent housing underpins all of this work. These are the areas of increased focus that we heard from communities that where we felt like we didn't do enough in the last plan, where you are going to see and hear a lot more from us on this. So really building and giving you tools and resources around increasing affordable housing, strengthening prevention and diversion practices, creating solutions for unsheltered homelessness, which is growing specifically. We're seeing much more unsheltered homelessness on the West Coast and in Hawaii, tailoring strategies for rural communities, and helping people who exit homelessness find career success and economic stability, and learning from the expertise of people with lived experiences of homelessness. And that is really critical, is bringing those voices to the table, and we want to do a much better job of that. So as I mentioned, the structure of the plan is set up under RARE, brief, and one time. So under RARE, this really is about building strong local systems that is grounded in data, expanding partnerships with mainstream programs and reduce fragmentation, and put greater emphasis on diversion and prevention strategies. We also want to reduce the risk of a housing crisis. And this is done in a variety of ways, but we want to make sure that while households are engaged with transitioning from systems like the criminal justice system, child welfare, from hospitals, that we're able to keep people from entering the homeless system at those critical transition points. And then we want to better target and prevent prevention assistance, so to make sure that we're keeping the housing crisis from escalating. So again, much more work on prevention. We want to ensure that homelessness is a brief experience. We want to support comprehensive outreach, increase access to low-barrier emergency shelter, and that's really important. What is low-barrier shelter really must be examined so that people can come inside if they want to come inside. Create strong coordinated entry systems to connect people to tailored housing and services, and create the pathways to permanent housing quickly. And then we want to ensure that homelessness is a one-time experience, and this is about connecting people to services to prevent returns to homelessness, like employment, connecting to employment and education to support upward mobility, providing connections to health and behavioral health care, child care, schools, family supports, and other resources. And then finally, we want to sustain an end to homelessness, supporting communities that have achieved the goal of making homelessness a rare, brief, and one-time occurrence by tracking and measuring key data points routinely, projecting and responding to future needs, implementing continuous quality improvement, and taking what works to scale, making sure that there is enough housing that is affordable for everyone. So if you are not connected to USICH's newsletter, I encourage you to visit our website because you will receive a prompt that asks you to sign up for the newsletter. This is where we push out a lot of guidance and tools from all of the federal partners, and as we work with our federal agency partners throughout the year in our interagency working groups as we implement this plan, as our working document, we'll be getting information out to you on our progress. So I encourage you to look at that. And thank you so much. And here's Karma.
Thank you. Let's see. Hi. My name is Karma Reed, and I know many of you, not all of you, but I do work here in Alaska, in Anchorage, with the Housing and Urban Development Office. I'm the Director of Community Planning and Development, so our office has some of the most direct relationships with organizations that attend the annual conference, but not the only office. There's plenty of other offices at HUD that also have relationships, and I'm going to talk a little bit about that today, too. My first couple of slides, I'm going to try to speed through because I want to get to the end, and also because it's been mentioned before, but my little twist on this story about the last year and the visits that have happened to Savunga, to Nome, and various places really starts a year ago. I think it was June. The USICH hosts regional meetings where feds and other folks that are invited meet to discuss a lot of these issues. And there was a listening session of continuums of care to talk about some of the benchmarks, I believe. And Brian Wilson called in, your dues at work, and he was very impactful and spoke about a recent trip he had taken to Savunga with Sue Steinecker, and the overcrowding that he saw, and he really made a big impact at that call, I think, and because of that, the USICH was sure to invite Alaska to participate in a September rural housing and homelessness convening in Idaho, or Boise, yeah. And out of that, oh, I didn't talk about AHAR. I'm gonna skip through that. Out of that, then the USICH sent Katie and another DC-based USICH member, Lindsay Knotts, as well as Jeff McMorris, up to Nome. We had a great tour there. Colleen and I went as well, and then we went to Savunga, and people saw firsthand what was being spoken about, and that was very impactful. And through that, Chris Kolarek and Brian Wilson were invited to address USICH directly in June of this last year. In addition, Lisa Murkowski held field hearing of the Senate Indian Affairs Committee in Savunga itself, and that was also very impactful. She had quite a bit of engagement with the community there, heard stories firsthand, and if you were here yesterday and you heard her video presentation, I think you could tell she really got it. I think that was a very important step. So I bring this up, you've heard this a few times, but I want to remind everybody too that it wasn't too long ago that HUD was not talking housing first. Do you remember that? Anybody remember that? Housing first was not something that HUD was behind. And that changed over time. And now I think you hear HUD, especially in CPD, we talk housing first all the time. It's like we never didn't talk about it. The continuum of care back in the olden days was this concept of people would progress from transitional to permanent housing, and they weren't ready for permanent housing at first, so let's put them in transitional first. And then, so maybe for some populations that works, but HUD doesn't say that necessarily for everybody anymore. Housing first is such a core piece of what we talk about and what we encourage in our programs. And I say that because these conversations with the field that are happening in Savunga and Nome and here with federal agencies, they can make a difference. So when you talk about overcrowding or high cost of housing, and maybe those things aren't perfectly identified in HUD's policies, that doesn't mean it always has to be like that. I think everybody is always listening. So keep bringing things up. It's a slow boat to turn, but sometimes it does turn, and just how very appreciative that we are to hear your voice as often as we can. There. One of the things that HUD has recognized over the last year is the partnerships between public and philanthropic partnerships, and Alaska was the recipient of one of those. Can you guess who it was? Philanthropic in Alaska, who would you guess? Rasmussen, yay. So Rasmussen Foundation, in conjunction with Alaska Housing Finance Corporation, which is a great partner with all of us, including Rasmussen, and all their various different efforts to address housing in remote rural with teacher housing and a variety of different partnerships with the tax credit programs, et cetera. So that was a great recognition. And then, because I am the director of CPD in Anchorage, I get to choose my favorite topic to bring up now, which is coordinated entry. And why is this important in the last year? Well, there was a notice in 2017, this doesn't look very exciting, but really it is, that identified January 23rd, 2018 as the year by which communities nationwide had to have coordinated entry policies in place and begin implementing them. So Anchorage was already underway. Alaska Balance of State, I think, did it on the 23rd, am I right, of January? And I think that was Brian's birthday. It was a great birthday present for him. And so we're really pleased that that has begun in statewide. And I know there's a long way to go, and this is one of the areas that we love to hear feedback, because I think as we move forward, as far as HUD goes, there's a lot of fine-tuning that coordinated entry no doubt will go through. And one thing I want to bring up right now is that while we talk about coordinated entry a lot, it is just required by a small proportion of HUD funds in the state. And you probably also recognize that too. Some of your programs, you must participate in coordinated entry. Others, you don't have to. So for the system to work the best way, the discussion has to be local. What makes sense? How do other programs participate that aren't required to? And to what extent? Are they full on in? Do people participate in case conferencing, but they also take applications outside of the system? These are all discussions that I'm sure you're all having, and they're so exciting. So to talk about some of those broader areas, There are 7 HUD offices that have direct investments in Alaska, and not in terms of loans, but in terms of grants, permanent investments. Can you help me call them out? ONAP, Office of Native American Programs, good, that's one. Public housing, there's another biggie. And there's mine. Can you remember where I am? Community planning and development. Okay. Multifamily housing. Ever heard of that? Ever heard of the 811 program? Sometimes that's been a discussion. That's out of multifamily. Well, here they are. So public housing, Native American programs, community planning and development, multifamily housing, lead hazard control and healthy homes, housing counseling, and fair housing and equal opportunity. Those are the 4 offices of HUD that have direct grants in Alaska. And so here's another guessing game. You got the 7. Which ones do you think represent? This is a variety of years, FY 15, 16, and 17, kind of lumped together, and which offices are which ones. So let's take the blue one. Which one do you think that is? Public housing, that's a good guess. ONAP, that's another good guess. Which one do you think it is? I'll narrow it down for you. It's one of those 2. How many think it's public housing? How many think it's ONAP? We got the director of ONAP over here raising his hand. Okay, it's ONAP, Office of Native American Programs. So the runner-up is purple, that is public housing. And then you have 2 that are pretty equal, and those are, what do you think those are? CPD and multifamily, there you go. And then the ones that you can barely see, the Office of Lead Hazard Control and Healthy Homes actually had a pretty good last year. They did a grant, I don't have the number right in front of me, but they do competitive one-time grants, and they actually did 3 in the last year. So they're the brown one, lead, brown, okay. And then the next one is Fair Housing and Equal Opportunity. That's our Alaska Legal Services, Fair Housing Initiatives programs, right. So they do operate statewide through their offices. They provide assistance for people addressing fair housing issues, and they do training and education and a little bit of testing. So there we go. Now, here's another question for you. So out of this whole pie, can you estimate how much of that pie actually HUD requires coordinated entry of? Do you think I don't know, a quarter of it? More or less? An eighth? Someone said an eighth? Okay, well, here's my hint to you. It's only part of CPD, and it's only about a third of CPD. So that's the required participation of CPD, of coordinated entry by HUD. So again, if you think that resources are important to address your list of vulnerable people in coordinated entry, you've got some local work to do, and this is just HUD. There's other agencies, other funding, private sources. There's a ton of other programs and resources out there that they're not going to be in coordinated entry unless you do the work to bring them there. And I'm just going to go through some of the announcements over the last year that HUD's made, and some of them are already part of coordinated entry, some of them are not, and some of them wouldn't really make sense, and I get that. But so let's, as a group, think maybe we can do this. Like, if you think it should be part of coordinated entry, or if you think it shouldn't be. And at the same time, I get to give you updates about what HUD's done over the last year. So we can do this all at once. So here we go. Continuum of care, grant awards. Yes or no? Thumbs up? Any thumbs down? I guess if you don't like if you don't like coordinated entry, you could do thumbs down. But yes, that's a thumbs up. Alaska Legal Services awarded Fair Housing Initiatives funding for outreach, education, investigations, training, testing. Legal Services, I have a thumbs up in the back, thumbs down, over here, thumbs down. So this is not a direct housing resource. It's assistance for people that might be getting evicted or having a hard time finding housing. So some of your coordinated entry systems, it might not be the best fit right now. Some of it might be. HOPWA, Housing Opportunities for Persons with AIDS. This is a renewal grant that we provide annually. It's pretty stable. There's not a lot of turnover, I think, of these housing. But when there is turnover, what do you think? Thumbs up, thumbs down, thumbs up. Okay, this is a permanent housing resource. It probably does make sense to be part of coordinated entry. Okay, another one. Section 811 Mainstream Housing Choice Voucher Program. So this wasn't even included in the pie because it's so recent. 50 vouchers for non-elderly disabled people, very recently awarded to Alaska Housing Finance Corporation. What do you think? Thumbs up, thumbs down, thumbs up. Okay, thumbs up. Something you could talk to your state about. Let's see, 22 new VASH vouchers awarded to AHFC, bringing the total to 308. This is a great resource for our community. What do you think? Thumbs up, thumbs down, thumbs up. Okay. And let's see, last slide. Veterans Housing Rehab and Modification Pilot Program funding awarded to Rural Cap. And hats off to Rural Cap, because I don't even think I knew this NOFA was out there until the announcement came out. So that's a great resource. I think it's for homeowners that need rehab. I'm not 100% sure. Yes. Okay. So is this a good resource for coordinated entry, do you think? Yeah, maybe if someone's in danger of losing their home because of modifications that they need, but this is probably more for people that are housed already, so maybe not the top priority to go seeking out. Healthy Home, this is the grant that made Healthy Homes a sort of slightly larger sliver, awarded 3 Healthy Homes production grants in Alaska to target health and safety hazards. Coordinated entry, good, kind of medium, right? Okay. Yeah, so as you can see, HUD's assistance, some of it makes sense to be connected to coordinated entry and some of it doesn't so much. But some of it that does is not required by HUD. So again, that would be a local discussion and a local negotiation that you'd have to pursue. And I think that was my time. Was that my time? I will move on. So Kathy. Oh, sorry. This is Kathy Gerard with the Veteran Affairs.
Thank you. And of course, I'm eating candy too, so I'm finishing chewing.
Tribal
Did you miss something?
Yeah, I'll let her finish her candy. And how do I go back? The last one, Tribal VASH. Very similar to VASH, but it's administered by either tribes or tribally designated housing entities. Yes, no, maybe? I got some maybes. Okay, so this is for homeless people, but it can also be, I think it's a little bit, it's not, you don't have to be chronically homeless. You can be near homeless and in danger of homelessness. So potentially a resource for coordinated entry, but it's not required by HUD. There, now, how's your candy? Good? Okay.
Hi, everyone. I'm Kathy Gerard. I'm, as I was introduced, I'm the Network Homeless Coordinator for Vision 20. I'm a clinical social worker, and I've been with the VA for a really long time, for actually 28 years. Over the last 10 years, I've worked primarily in VHA housing programs. I actually know quite a bit about VA homeless housing programs as I've been working with them as they've grown over the last 10 years. So actually, I'm not sure. Okay. Oh, great, you were able to bring up my picture. So since the plan to end veterans homelessness started many years ago, we've had several secretaries come through the VA. Secretary Shinseki, he was the primary driver for the Secretary's plan to end veterans homelessness. But as everyone knows, he left. And then we had another secretary, Secretary McDonald. And then we had Secretary Shulkin. So now we have a new secretary, and many folks like myself are sort of wondering, like, what's our leadership going to be like for the next coming year or two with this new secretary. And so I was really happy to see that Secretary Wilkie took time out to come up here to Alaska and spend time at a stand down. And there he is with I'm not sure if it's a veteran or like a service provider, but he's there shaking the veteran's hand and trying to understand some of the work that VA does with homeless veterans. I'm not sure, were any of you guys there at the stand down this year? Yeah. Yeah, so I wish I had been there, because whenever I go to a stand down, it reminds me of how important it is to be out there in the community and do the outreach and sort of connect to the veterans and then just connect with other providers. So I'm so happy that he was there, and that's a good indication to me that he's behind our programs. And one of the things that he mentioned when he was there that made the press release was how important it is for us in the VA to really make a stronger effort to outreach to our rural communities. I have to say that when the plan first started, we had a big emphasis on the large cities, and the large cities got a lot of resources, and for the last couple years, we've been really working hard to do a better job in our rural areas. So it looks like we're going to get the support of the secretary for that. I did it. I knew how to click. So here's just the homeless programs for homeless veterans. I don't think I need to read through all of these, but I might just say a few words about each program, kind of to put it into perspective for the continuum of housing that we have. So the domiciliary care for homeless veterans, it used to be called the DOM, and I've heard it referred to as the DOM since I've come up here to Alaska, but it's actually has a fancier name. It's the Mental Health Residential Rehabilitation and Treatment Program. Yeah, so I think the name change is really sort of the VA's effort to put more of an emphasis on providing more intensive clinical services for veterans that are in a crisis type situation, veterans that need a safe and secure environment to stabilize before they're able to move on into permanent housing. You guys have a pretty big DOM considering the size of your area. And I know that from my one visit to the DOM, they really do make an effort to be low barrier as possible as you can be in this type of situation in terms of a residential environment. The secretary also toured the domiciliary too, and I know that there's really good connections between the residential programs and the justice programs, and that's really good to see. So you've already heard about the HUD-VASH program from the other speakers. The HUD-VASH program is the biggest program that VA has, and I think our most effective program at ending veterans homelessness. It's where we have the most resources, the most staff, and I think just the most, we've had the biggest impact with HUD-VASH. HUD-VASH is housing first, so veterans shouldn't be required to be clean and sober before they're housed. In HUD-VASH, we can sometimes serve veterans that can't be served in other programs. It's meant to be really low barrier. My numbers up there are saying that we have about 326 vouchers in the area. Hopefully that's correct, and there were new allocations this year, which means that you're doing a great job managing your program. Actually, when I look at the numbers up in Alaska, which I do on a very regular basis, I look at utilization and how well you're doing with making sure your vouchers get into the hands of veterans, and that's really great to see. You've already heard about tribal HUD-VASH, but the one thing I just want to add to it is it's actually housing first too. So veterans shouldn't be required to be clean and sober to enter into the tribal VASH program. urinalysis, things like that should not be required. Veterans should be able to access it without any requirements or without too many requirements. I want to say that Alaska has the biggest tribal VASH program in our network in the 4-state region and Region 10. You guys have made the program up here in the 2 areas very successful. The reason that it's successful here is because of the community and because of the partnerships and because of the public housing authorities or the tribal housing authorities. They've done an amazing job kind of coming to the table and saying, how can we support this? How can we make this work? We haven't been able to get up to full speed or even really get started in Bethel yet, but we're hopeful now that we have our case manager on board that we can get started and get moving, and that we'll have as much success as we've had in the other areas. We have a compensated work therapy transitional residence. Have you guys ever heard of that? So that's basically clean and sober housing. It's an apartment building that the VA owns. There's 24 beds. It's for single veterans, and we only have 2 of these types of programs in Region 10. But basically, it's where veterans can come and stabilize and get employment. It's not for a veteran that would need a HUD-VASH voucher. This is for like a veteran that's probably going to be able to get housing on their own at some point. Grant and per diem, you don't have a lot of grant and per diem resources in the state of Alaska, which is unfortunate. Grant and per diem at one time provided capital and renovation funds for communities to build transitional housing for homeless veterans. So nowadays they're just doing the per diem. And so agencies that weren't part of the program before it went through its sort of transformation, it's been hard for them to apply for some of these funds. The most recent period that people could apply was last year. And you know, we were able to make sure that we still had the resource here in the Alaska Fairbanks area, but it would be great in the future if there was ever another NOFA to be able to get more of that resource here. Grant and per diem has different types of models. So there's low barrier grant and per diem, there's clinical treatment grant and per diem, there's hospital to house. So it's sort of remade itself, but there still hasn't been enough opportunities from my perspective for community providers to kind of opt in and be a part of the program. So hopefully in the next year or 2, we'll see more opportunities. Veterans Justice Outreach Program, this is one that is, we think it's one of the most successful ways to intervene and outreach to homeless veterans that are involved with the justice system. I don't know if anyone noted that President Trump announced that he was going to expand the program by 50 specialists this year. We're still waiting to hear whether or not we're going to be able to get any of those specialists in our visit, but we're hopeful that that will happen. We've found this to be a very successful program in terms of connecting veterans to treatment and keeping them out of jails and prison. The next program that we have is just employment programs. I won't say too much about it, but we do have some employment services available for homeless veterans. I'm not going to talk about tribal VASH because we've already talked about that. I'm just going to mention supportive services for veterans and their families. I don't provide oversight for SSVF services. That's done by a different regional coordinator. That's Remy Knuckles. But I do know that SSVF has been a really important component of our continuum and one of the reasons that we've had so much success housing homeless veterans. The nice thing about SSVF is that you don't have to be healthcare eligible in order to receive services. SSVF they have more flexible funding and they can do more than we can do with our traditional VHA homeless programs. And SSVF can work very well in terms of connecting veterans that aren't going to be sustainable on their own to HUD-VASH. So it's a great program, and you have you probably know it, but you have 2 programs here in Alaska. So back in October of 2017, the VHA issued guidance to all the medical centers requiring that the medical centers become actively involved with their continuums of care, that they actively participated in coordinated entry. There was an assessment that all the medical centers had to do, telling myself and then the VHA leadership where they were at in terms of that coordination. And so they had to do like an assessment and basically say what they were doing and kind of what help they needed, if they needed any help. So all of the medical centers completed that, and we got back that information, and then we've been following up with the program leads and the stakeholders to see, you know, if there's anything that we can do to make sure that everybody's completely compliant. I'm not sure if you can see all of this, but basically our expectation is that every medical center will be involved in the continuum of care in their surrounding communities. So some medical centers just have 1 COCs, some medical centers have 3 or 4. And so typically what we see is that the medical centers do a really good job connecting to the bigger areas, like the bigger urban areas that are in close proximity to the medical center, and it's much harder at times to connect to the balance of state areas. And so that's where we've seen more of a struggle with helping medical centers where they've gotten multiple continuums of care, like helping them to make sure that they're there at those meetings and that they're case conferencing. And so that's more challenging, but we're making progress. And it sounds like you guys are doing a great job here too. In Alaska, you've got a lot of things, in Anchorage, you have a lot of things established, as well as the balance of state. There's a lot of movement happening. So this was just part of a presentation that Eileen Devine did a couple weeks back in San Diego as part of the SSVF conference, and she let me borrow the slide. But basically, these are some of the challenges that communities have implementing coordinated entry. And I can say that in our area, in Region 10 and Vision 20, we have some of these issues in probably not all of these issues, but a few of these issues in each area. So it just depends on the community, it depends on the resources, it depends on how many VA staff are there. But these are just some of the issues that can come up. HMIS, VA sharing data with the community, and then information sharing. I think we made a lot of progress this year, making sure that we're able to do that with our partners, but we still have some issues in some areas with that component. So the gap analysis tool, so this is, right now it's up, well, let me back up. So the VA created a gap analysis tool for each VA medical center. The tool is meant to help VA MCs and partners assess any gaps in resources and develop strategies to address the gaps. So I'm not going to read the rest of it, but hopefully if you're on a continuum of care board or committee and you're working with a VA partner, you've seen what that gap analysis looks like. The VA they update it every year, and this year they're currently in the process of updating it with all the new SSVF resources, all the VASH vouchers, things like that. They also are able to pull in HMIS or I'm sorry, like nonprofit agencies that are part of HMIS. And so it's much more comprehensive than it used to be, so it's a better tool. And I'm sort of mentioning it now because right now is an opportunity for the VA Medical Center, and in this case, John Pendry. You guys probably know John. He's having to take a look at it to make sure it looks accurate. And one of the things that you can do with this gap analysis tool is you can add in your by name list in lieu of the point in time count. So if you feel like your point in time count doesn't necessarily represent your community in terms of the needs for veterans as well as your by name list, it is possible to take your by name list, if you have a by name list, and use that to kind of demonstrate what the needs are. And it's my understanding, based on my conversations with people at our clinical operations department at headquarters, that this gap analysis tool will become really important in the future in terms of working with HUD around voucher allocations. And if you have more questions about this, I can answer that. I can answer them later today. So in September of 2018, there was a community planning survey that we conducted. SSVF partners actually were the leads in terms of working with the COCs to fill out the survey. So your SSVF partners here most likely took the lead. And basically, when I looked at it, so the results are still sort of like being reviewed, and I got some information. I don't have a lot of information to share with you about the results of the survey. But basically, you know, what I've learned is that you guys have leadership committees, and that you've made a lot of progress, and you've decided on a prioritization tool, and there's work that needs to continue on integrating the various systems, probably the VA. But yeah. Okay. I am being signaled that I'm out of time. And I just appreciate the opportunity to have a chance to talk about some of this stuff with you guys, and I'll be around later, and thank you.
Good afternoon. My name is Mercedes Garcia. I want to thank Katie and Colleen from HUD and Katie from USICH for inviting me to be here. This is my third time in Alaska this year, so I come here often. I work for the Office of Indian Services in the Bureau of Indian Affairs as the Tiwahe National Coordinator. Tiwahe is a Lakota word that means family in the Lakota language. And so this is an initiative, it's a pilot demonstration project that has 6 pilot sites in all different BIA regions. The Association of Village Council Presidents in Bethel is the only pilot site located here in Alaska. This is an initiative that is, I think yesterday someone from Fairbanks mentioned destruction of silos, and that's exactly what this initiative endeavors to do. It is really about coordination of services as its first federal goal. Its second federal goal is to integrate culture into services at whatever level and to whatever degree the tribe implementing would like to. The third federal goal is to promote self-determination and self-governance. And so to that end, each pilot site created its own Tiwahe plan and determines how it wants to implement it and what its priorities are within its communities. This is an initiative that is focused on family, child welfare, social services, Indian child welfare. And so much of the work obviously encompasses housing, job, workforce development, substance abuse, when we're working with children in and out of home placement. And so that has been an area where all of the tribes are doing something very, very different, but they all share the common goals. And the fourth federal goal is to provide models to all tribes so that all tribes in Indian country can benefit from the demonstration project. And so I'm really here to discuss a forecast of something to come by the end of this year out of the initiative. So a demonstration project is meant to demonstrate something. So in this project, it's meant to show that allowing the tribe the flexibility, not a closed box set of guidelines that they have to conform and create a plan within, but actually allowing them the blank page to complete a plan or make a plan and then implement it. really has resulted in a Tiwahe framework. The tribes that I work with, besides AVCP in Bethel here in Alaska, I work with the Fort Belknap Indian community in Montana, the Spirit Lake tribe in North Dakota, the Red Lake Nation in Minnesota, the Ute Mountain Ute tribe in Colorado, and the Pasquayaki tribe in Arizona. 5 of the 6 sites that I work with are rural areas. They are all developing models that I think will benefit Alaska, and much of the work that is coming out of AVCP will actually benefit the lower 48. This state is vast and very large and very rural, and many of the communities in the lower 48 are as well. So I think I'm very grateful for the invitation and ability to attend here this week. I'm certainly going to take back much of the work that you all are doing and share it with the tribes. And the goal is to coordinate more closely, not only with other tribal partners and within tribal agencies or tribal governments themselves, but also with state partners, local partners, and private partners. And so the tribes have developed a partnership with the Maori from New Zealand. And in New Zealand, the Maori actually have a policy that's called Whana Ora. And that in Maori means family well-being. And it is an initiative, it's actually a government policy that is similar to Tiwahe. And so my former Deputy Bureau Director at Indian Services actually had the opportunity to meet the one Maori, or the CEO of one of the companies there, who was assisting and wanting to coordinate with our fellow tribes here. And so out of that grew a partnership, and the 6 pilot tribes have been working very closely with the Maori. And the Maori have developed a framework, a performance and data framework. And that framework posits that the government doesn't always do a great job of telling our story and providing data, native stories, and with data that it asks for, or with the data that it requires that tribes collect. And so the framework, the Tiwahe tribes have adopted this framework and have collected their own performance data that they've been required to keep and mandated to keep by Congress. And what we will do this year is put it together in a report with the data that they've collected and within the framework that is that's created in order to demonstrate that if we have 7 common level population outcomes as in Native people, and we all are realizing and have different goals and priorities and are working through those differently at our own local level. But if at a higher level we have 7 common priority areas that we're working toward, anything that we're doing on the ground can kind of be looped up into these 7 priority areas. And we can demonstrate that we're all working toward the same thing. And so I tell you that because last year in fiscal year, well, now we're in fiscal year 19. In fiscal year 17, the Tiwahe tribes produced an annual performance report. It's a 17-page document that illustrates what they're doing in each of their communities. It contains their individual tribal performance metrics. It shows fiscal year 14 data and data for each year thereafter in the initiative to demonstrate the change, the improvements, or the decreases in some of the areas that they were looking to focus on. And so that report is available. I'm happy to share that, and we're working on our fiscal year 18 report now. For fiscal year 19, the data will be compiled within the Tiwahe framework. And one thing that tribes have stated consistently for a very long time is that IT and an IT tool to actually help connect services, to connect folks, service providers, is essential in order to assist with this coordination of services, to break down those silos. So the New Zealand group has developed an IT tool that they use. Actually, it started in their health hospitals and has gone out from there with their social services agencies, tribal justice, et cetera. And so this IT tool will be a part of the Tiwahe framework report that we produce at the end of this fiscal year. So I really encourage you to look out for that framework report. Many of the tribes in the area of housing, the Red Lake Nation in Minnesota is engaging with local COCs there, as well as other non-pilot tribes, to leverage the housing dollars that they've received under this initiative and really make those go further. And then also, one thing that has really come out very strongly here, especially in Alaska by AVCP, is advocacy. These tribes have really moved forward in this initiative with one voice and advocating for the issues that exist within their region. Here in Alaska, AVCP has been an extraordinary advocate for many of the things that we've discussed over the past 2 days, including the high cost of building, the inability to find affordable housing, et cetera. And so those are some of the things that have come out of Tiwahe thus far, but I really encourage you to look forward to that framework and the other models that will come out. That report will contain the framework as well as guidelines for tribes, so models that tribes can utilize, and also measures of success. So that will actually be the performance guidelines. I'm happy to take any questions, and thank you so much for the opportunity to present. Thank you.
So I think we have a little more time. Any questions for any of the presenters? Well, hearing none, I would like to say thanks to the panelists. Please join me in giving them a round of applause. Thanks to those that traveled, and as Kathy was saying, of course, we're all here the rest of the day, but we're also available anytime, so please use us as a resource, and thank you very much for inviting us to be a part of your conference.